mostly in the kids, of course, and very young adults. It depends also on the type of tooth we transplant. If we transplant a developing premolar, it's about 10, 12 years of age. If we transplant a developing third molar, it's later about 15 or 19 years of age. So it depends. There are very, very different treatment protocols. I would like to focus on the autotransplantation on developing teeth, which is a surgery we are performing in young patients. So starting with the, oh, wait a moment, my forward doesn't work. Wait a moment, I've got a problem with this. Okay, starting with the very short brief of the presentation, I will tell about the application of this treatment, because this is a treatment not for everyone. And not in every case we can perform autotransplantation. Then I will talk about the selection of the donor. Donor tooth, this is a tooth we are going to transplant. Once we transplant it, it is a transplant then. Before, it's a donor tooth. Very shortly about the pre-surgical treatment. Pre-surgical treatment, mostly it is an orthodontic treatment or a pediatric treatment, periodontic treatment. I will briefly describe the types of the surgery which we can perform with developing teeth. The follow-up after the surgery is extremely important, because then we'll see how our transplanted teeth, how they develop, how they heal after the surgery. And we can also see, very rarely, but still sometimes we can some complications. And if we detect this complication early, we can manage them in most cases. So the follow-up is very important. Obviously, after some types of surgery, the post-surgical treatment is necessary, and it is mostly the orthodontic treatment, because we need to align the tooth with an adjacent teeth. And in some patients, especially after autotransplantations of teeth, to replace the incisors in the maxilla, obviously we have to do the preparation of the transplant to make it more similar to the shape of the incisor. So the transplantation, it's not the treatment you can perform alone. So basically we need a team for a transplantation. And most commonly, there are orthodontic indications for autotransplantation.